cardiovascular heart disease is one of the most common causes of death in Malaysia. It's not only in Malaysia, it's a globally international cause of death. So when we refer to the cardiovascular heart disease, there's too many conditions in the heart. Today we are focusing on the narrowing of the coronary artery in the heart. So we call the heart attack. Okay, when we talk about the risk factor of the cardiovascular disease, you can divide by two categories. One category is what we call the non-modifiable risk factor, and the second is a modifiable risk factor. So when we refer to non-modifiable risk factor, they including of the age you cannot modify, the gender you cannot modify, and the hereditary is you cannot identify. So when you talk about the not modifiable risk factor that you can modify or you can change this risk factor. For example, there's a diet, the exercise, the obesity, the hypertension, and or smoking also. You can change or you can modify this kind of risk factor. Okay, the high blood pressure, they can contribute to the coronary heart disease that they can cause the hardening of the coronary artery itself. When the blood pressure is high, they can give the extra force against the artery walls. They can damage the coronary artery itself. So smoking can cause harmful to the coronary artery disease. The substance in the smoking can cause damage to the what we call the lining of the arteries. They can more susceptible to the plaque build up and then can reduce the amount of oxygen in your bloodstream. Preventive measures are highly effective to reduce the risk factor of cardiovascular disease. Alright, first, adopting the heart healthy diet, which is eat the rich in fruit, vegetable, and the whole grains and proteins to manage the weight gain, and it can reduce the risk factor of the cardiovascular disease, and also to control the cholesterol level and the blood pressure level. And the very important also, the regularly the physical activities, at least 30 minutes in most days, and then the quitting smoking is one of the best thing that people can do to reduce the risk factor. And additionally, people can managing the stress level and then limiting the alcohol intakes, and then getting the regular health checkup at least yearly to monitor the blood pressure, blood cholesterol, and the sugar level for the patient.
Education.